The forward interlocking suture pattern is one that's more commonly used in large animals, although it may have some utility in small animal surgery as well. The forward interlocking is a continuous pattern, and unlike most continuous patterns, which we place from dominant hand to non-dominant, so from right to left for me because I'm a right-handed surgeon, the forward interlocking is one that we place from non-dominant to dominant, or in my case, from left to right. If I'm suturing a vertical incision, as sometimes may happen in large animal, then I'm going to start and go from right to left for myself and from top to bottom. So in this case, the reason that I'm choosing to start there will become apparent in just a minute. So I draw this through, and like other continuous patterns, I go ahead and tie my first knot. Nylon is going to stay a little bit loose on that first throw. I'm going to bring it a little bit tighter on the second and bring the tension all the way to where I want it on the third. I want to leave a little bit of room for the space, a little bit of space in the suture for the skin to swell, and then cut my tails at 1 to 2 centimeters. So when I create my next bite, I'm going to basically take what would look like another simple interrupted bite or simple continuous bite. So I'm going to come about 8 to 10 millimeters down from the first bite, so a little bit farther than usual, and about 5 millimeters back from the cut edge. If I need to come up in the middle, then I can do that. The curvature on this needle is rather shallow, so in this case I'm going to need to do that. And so what you'll see is that the loop created as I've come and take my next stitch, I'm going to draw the needle up in the middle of that loop. And when I do that, it creates a little square. When I take my next bite, I'm going to create the next square. So again, I'm going to come 8 to 10 millimeters down, pass my needle through, and make sure that it comes up through the loop that's created by my previous stitch. The reason that this stitch is done from non-dominant to dominant is because it allows this loop to fall naturally sort of in your way so that it interlocks a little bit easier. One advantage of this pattern is that if you lose one knot on the line, there's a possibility that you won't lose the entire line because the interlocks may hold. When you're looking at these, you want them to each be square rather than rectangular. So I could have gone a little bit farther down the suture row before placing this one because you can see it end up as a little bit of a rectangle. When I get to the end of the suture line, there are a couple variations on how to finish it. The one that I like is to reverse the direction of the needle and the drivers and come another 8 to 10 millimeters down from my cut edge. Do the same on the far side, backhanding my needle, and draw it up. And then go ahead and tie that to the loop. The forward interlocking is unlike some other continuous patterns because it's very easy to tighten it at the end. So if I still have some looseness at this point, I'm going to go back and check them. The easiest way to do that is to tighten each one of the boxes sequentially at the bottom corner. In this case, because it's nylon, it's going to loosen slightly the last couple boxes when I tie. That's okay as long as it ends up tight enough. If I had a longer incision line, it would not loosen the very early stitches in that incision line. So I'm going to tie to this loop, and as I do so, I'm going to make sure that this comes snug enough. So in this case, I needed a little help in doing that. Open my drivers, and I'm going to try to pull my knot down to the bottom of the suture line, at least when I get my second throw on. Nylon has memory, so it likes to go back to the shape it was in this case in the packet of suture. So I'm going to snug it down and give it a little bit of help, a little bit of encouragement in making it the shape that I want it to be. So now I'm going to tie on 3 additional throws, again trying to keep the knot just off of center. Actually, I think because this is a loop and I'm in the skin layer, which I'd really like to have stay together, I think I'm going to choose to do 6 throws. Being careful each time to open the needle drivers and get nice square throws rather than half hitches. So the forward interlocking pattern, when you look at it, should have exactly equally sized boxes all the way down the pattern. Although perfection isn't necessary, it does help to be reasonably accurate in the placement of this pattern.